Good morning, my name is Carissa Tucker, and I will be sharing my reflections on group grief counseling. Please note that I will be referencing from Worden's book, the Grief Counseling and Grief Therapy, the Handbook for the Mental Health Practitioner, as well as two other sources for my findings. I will be sharing the principles and procedures in Worden's book in facilitating uncomplicated grief, specifically looking into risks and benefits between individual versus group grief counseling. Some may say, even argue, one is better than the other, but realistically, they do provide distinct platforms in dealing with grief. As I have been learning, the overall goal of grief counseling is to help the survivor adapt to the loss of the loved one and to be able to adjust to a new reality without him or her. With that said, let us investigate and dive in to the risks and benefits of individual versus group counseling. When it comes to the individual grief counseling, it is normal for some people who struggle with tasks of mourning to seek professional counseling for help with thoughts and feelings and behaviors with which they are finding it difficult to cope. Still others who have not sought out counseling directly often accept an offer of help, especially when they're having difficulty resolving the loss on their own. There are 10 counseling principles and procedures that Worden lists out, but for the sake of time, I'll be sharing 3 of those. So the first one, principle number 1, is helping the survivors actualize the loss. So this is actually quite important in helping them verbalize and talking about the loss, talking it out loud, speaking out loud about it. It helps them just come to the reality of it. Another example of this is visiting the grave site, and also helps with accepting the reality of the loss. Principle number 6 for my second one is providing time to grieve. This is actually quite important. I think not only for the client, but also for the counselor, because everyone has a different timetable when they grieve, and it requires time. So impatience cannot happen during this time. It needs to just let itself work out in its due course. And some things to remember are the 3-month mark. After a while, people start forgetting that person has lost a loved one. And so at the 3-month mark, they've noticed with research that things start changing, and they start forgetting that lost loved one. And so that's a key moment for a counselor to check in with them and see if they're okay. Also, the 1st-year anniversary is another key marker, as well as holidays. It's actually quite good for the bereaved to prepare themselves mentally beforehand, knowing that holiday at Christmas is coming along, and for them to prep themselves emotionally and mentally. And principle number 9 is examining those defenses and coping styles. This could either be from blame, distraction, denial, from social withdrawal, and substance abuse. So if these are instances or key coping styles that a counselor can see, then it's actually quite good to tackle those beforehand during that time. As we move on, we're going to look at just the possible risks that can be involved with individual counseling, individual grief counseling. Research has shown that a small subset, about 10 or 15% of bereaved people, will continue to struggle and develop some type of complicated mourning, such as chronic grief reactions or prolonged grief disorder. And because these difficulties require special techniques and interventions, as well as an understanding of psychodynamics, dealing with them may not be within the purview and skill of the grief counselor. So at this time, it actually is important for the grief counselor to be aware of his or her limitations and refer that person to possibly grief therapy or even psychotherapy, so that their situations can be handled further. Now, when it comes to grief counseling, once again, we do see some benefits and risks as well. So we're going to first talk about the benefits in group grief counseling. If it is conducted well, and there are guidelines set in place, this type of counseling is quite effective. So there are several on here, but I will be mentioning 3 for the sake of time again. The first one is choosing a group format. This is quite important because it could either be an educational one, or a emotional support, or a social purpose type of group. Many people, each individual is going to be coming there for a different reason, and it's important to make that obvious at the onset, at the beginning of it, of what kind of group it's going to be. What is it going to be catering, helping, serving for that client? Another one is establishing ground rules. That's quite important. And if it's there and if it's set, it can be quite beneficial. Providing that structure and establishing that leader's position well is very good as well, because it's setting beforehand what those ground rules are going to be. Another one is determining the leadership approach. Is it going to be co-led or is it going to be single-led? Now, if it's being co-led, a huge benefit is if those 2 leaders do debrief after each of those sessions, so they can talk about what has been discussed, and what they can do better, or what they can improve, and what they can change. But if it is one leader, it's quite important to determine and to remember that to find a group, or find yourselves in, if you are a person that's leading and you have also that experience where you have lost someone through, let's just say, car accident, or even cancer, one of those 2 things, let's just say as an example, it would actually be good for someone else in that group also to be that, finding themselves in that place too. And if that leader has that compatibility, they'll be able to actually speak further into that group because they have that connection. And number 6 is also number 6 of the 7 that I'm going to mention, of just a few of them, is just understanding the interpersonal dynamics. People want to feel safe, they want to feel important, they want to feel included. And with that said, it's important for the leader to not play any favorites. So that's a really good, healthy boundary to instill. So if those are put in place, it's actually quite helpful, beneficial, and it will be the highlights of making the group grief counseling effective. Another form of group grief counseling can come in the form of experiential techniques, as shared by Professor Ehlers and Scalise from the HCU online videos. And so they were speaking about this, that these techniques can help move beyond the heart to the head, beyond the head to the heart, excuse me. And many times they can be facilitated in group settings, hence that's falling into this category, because it allows people to get past those traditional defense mechanisms and allowing them to influence those emotions and have a deeper insight, one that hits beyond talk therapy. Sometimes being in a room with just that one person, that counselor, can be quite intimidating, but maybe in that group setting, it actually could be a little bit more freeing, a little bit more open to know that there's others that are also experiencing the same thing that they are. And also they've noticed that they've found that many clients utilizing experiential methods report fewer feelings of inadequacy and inferiority. So most importantly, it helps people experience their pain in a safe environment, and it's a tangible approach, as the professors were including in this. Now, some of the risks, though, of group grief counseling, which we can find as well, is if a counselor discovers that the client is actually struggling with, let's just say, post-traumatic syndrome disorder, or with severe trauma, or even with a dissociative disorder, it's actually not going to be helpful for them to be in a group setting. I actually needed to look up what a dissociative disorder was. So according to the American Psychiatric Association, they labeled this as a disorder involving problems with memory, identity, emotion, perception, behavior, and a sense of self. And these are frequently associated with previous experience of trauma. So, as said earlier, in these group settings, these type of clients would not respond well, and they would need to seek help in psychotherapy or the like. So as we move further, as mentioned earlier, it would seem best fitting for a bereaved person to join a grief counseling group when they show indications when they cannot easily speak about their emotions or have difficulties getting to the heart of the matter and are struggling with those raw and fear-based emotions that are not coming to the surface. If this occurs, a group setting might be the next step toward healing. Many times people want to express their grief as opposed to simply talking about it. How can they express their grief? Sometimes this is through art, sometimes this is through music, sometimes this is through play, which they also call it as psychodrama. So a group setting allows the individual to find commonality with others who are struggling with the same type of grief, hopefully. Now, the main role of support groups in grief counseling is that it is an effective way to offer emotional support to the bereaved person. And it is the emotional support, the educational, or the social purposes that are going to be the three key aspects to a group grief counseling. And so if those aspects are put in place, then those who are seeking a group setting can find those things. Because of these aspects, the bereaved actually can feel welcomed, and they can feel safe, and they can be included. Well, thank you so much for your time and for allowing me to share my reflections and my findings on the benefits and the risks of group grief counseling, and even looking and diving into individual grief counseling as well. Thank you so much.